Okay, we're going to switch gears here and we're going to start talking about healing phases. And the reason for that is because we have just now spent modules 3 through 5 talking about the pathomechanics of different tissue types. So we've talked about bone, we've talked about the structures of a joint, and we've talked about muscle. And the reason for that is as we move forward to the rest of this semester, we're going to just be talking about human injuries as they occur by each joint. And when I talk about them, it's important to understand what the differences are between muscle and bone and ligaments and capsule and different types of cartilage and things like that. And part of that is the healing phases, because the healing phases are different because of the blood supply of each of those structures and then what they're made of and how those heal, and then also where they're located. So we're going to talk about the healing phases. And if this is familiar to you from your sciences, then great, but it is going to be a little different. So when you get into DPT and MAT, you may use different phrases. So, because we're going to focus on the phases of healing that really affect the rehabilitation plan and intervention. So, instead of just having the proliferation and remodel, which can take months up to a year, just as um, whole sections, we're going to actually divide those into two. So normally the healing phases are hemostasis, which is bleeding. And then once you control that, which is very acutely, then the inflammation process can start. And inflammation is normally 2. Well, for any kind of rehabilitation setting, when we're intervening, as far as like physical therapists or athletic trainers, or even people in the clinical setting of physicians and things, typically we're beyond what the first responder is doing with the hemostasis, and we're moving to controlling and handling all these other healing phases to optimize these phases. And that means help them occur in the time that they need to occur to help us heal without exceeding that and without affecting secondary tissue and causing secondary tissue death, which will then create more complicated injury recovery. So I will talk more about this as we get joint by joint and specific injuries that this really applies to. So for the rehabilitation, I'm going to call them rehabilitation healing phases. And that's what I will be referring to in this class. And that is what I will assess you on. So these phases are these: inflammation, proliferation, and then we break down remodel into 2: early remodel and late remodel. So what's happening in these is inflammation is just, all right, so we have the clot from that hemostasis, and now we've moved on. Now the inflammation is the blood vessels are dilating, and they're trying to bring in all of those cells in to mediate, to basically clean out and debride the wound and get all the yucky stuff out, while also starting, those macrophages are really important. They're white blood cells, and they're coming in and they're clearing out that dead cell, but they're also starting to lay down that first layer of tissue repair. This is usually a 24 to 72 hour situation. So when you look at like a wound, for example, like an abrasion or something where you scrape your skin, it's when it gets really red and inflamed and the outer edges are all red. And then when it starts to calm down and you get that scab, that's when we're going into that proliferation phase. Proliferation is that start of that repair. It's forming that new temporary, relatively weak connective tissue that's just like that transitional period to give us time to put that really strong skin, that really strong collagen, that really strong tissue repair of whatever we're healing. So proliferation is where we're calling that weak connective tissue is the granulation tissue. It's coming in also as microscopic blood vessels that are going to start that blood supply again. Also, we're going to get that re-epitheliation. So it's that skin layer healing, or that scab is going to regular skin. And then we're also laying down different things, but what I really want to focus on for this class is the collagen. So it's laying down what's called type 3 collagen, and we want it to turn to type 1. So please note that they don't go in order. It's not type 1, then type 3. Type 3 comes first, and it's a weaker, thinner, just like that transitional collagen to be able to give it some strength and some tensile strength. But it's going to slowly be reinforced with that type 1 collagen, which is much stronger. It just takes a lot more time for that to happen. So typically this phase proliferation is going to happen when inflammation it's a crossover, obviously. So somewhere around 2 to 3 days out. This all depends on the type of tissue. Is this surgery? Is this just a little wound? And what tissue we're dealing with, but we're just going to do general concepts so you can kind of understand the general timelines of this, of like inflammation is very short, proliferation is the next, and then remodel is much longer. So proliferation generally goes to about 3 weeks, and then we start remodel. We break early and late remodel because of for rehabilitation purposes. So the whole point of remodel is to be making this tissue stronger and back to pre-injury tensile strength or stronger. So really, there's a lot of things that are happening, but one thing I want to focus on is that type 1 collagen is being laid down to reinforce that type 3, making it really strong. So for example, people start feeling really good after ACL surgery right around that 6 to 8 week mark. So we're almost 2 months out. Man, we feel like we can jump off boxes and we can sprint full speed. Well, we don't have type 1 collagen. We don't have all those strong reinforcements there. So this is often where if you're not under the control of people who know what they're doing and you're just going off on your own, people can re-tear right around this time frame, that 2 to 3 month time frame. So it's really important to allow the body to do what it needs to do and also to have clinicians who know what they're doing to help you do that. So in that remodel phase, we're calling it early because this is when that type 1 is coming in. We're getting really strong. We're building strength. We're starting to build some power, making sure we have that full range of motion. And we're just basically getting up to pre-injury levels. When we get to late remodel, this is when we're fully strong. We think the tissue is back to pre-injury levels, but now we need to build that power and the agility, things that we really can't start building at a high level until we have a fully strong tissue again. So that's why we break this into early and late remodel. So that late remodel is when we're going to be doing those heavy plyometrics and those really high level agilities, and we're going to be doing lots of power exercises and strengthening and things that we should not do until that tissue is back to pre-injury levels. When we talk about healing timelines in general, what I want to emphasize here is that healing timelines correlate with blood supply and correlate with health and correlate with age. So the younger you are, the more effective you typically are in healing. The healthier you are, the more effective you are in healing. So if you have any kind of underlying disease, especially if it's like bone health or blood supply, or if you have diabetes or smoking, those are also common things that can impede healing. And then also the older you get, the more inefficient we get in healing as well. When we talk about just tissues itself, we're talking about just healthy people, healthy adults, and we're just comparing them, the quickest is going to be a muscle because it has really great blood supply. And then after that, it can be, depending on the severity, it can be tendons, usually because there's a combination of muscle properties. However, tendons really function like ligaments, and they are full of collagen and connective tissue, and they don't have great blood supplies, so typically those are hard. Bones can be easy to heal depending on the type of fracture, where it's located, and the person that it is. So what I really just want you to take from this is muscle is the quickest, and then tendon and ligaments really struggle depending on where they're located and what kind of blood supply and what they're made of. And then bones can also be quick in young children, and they can also be long in older people, and also depending on that type of fracture. So these are just basic concepts. We're going to refer back to this. I would save this module page, and this is something you should refer back to as we go into those later modules. If you have any questions, please reach out.